After hearing everyone's stories, I found how privileged I am to just be able to feel normal when everyone else is going through these sort of pain.
I think it's made me realise that maybe I need to book back in with my GP.
But I guess what's important to understand is every woman's experience of a period is different.
Hey everybody, I'm Angie Kent and welcome to the F Chat. We're encouraging everybody to talk about fertility. We want to normalise the chat. Whether you want to talk about it with your friends, family, doctors, this is what we're doing. So welcome. Before we get started, I'd love to do a little intro. So let's start on this side.
Hi, I'm Dr Abigail Evans. I'm an obstetrician, gynaecologist and fertility specialist from the Gold Coast.
I'm Alisha, I'm 34, I'm single, and I'm just exploring the world of fertility and what that means for me at my life stage.
I'm Sheng, I'm 29. I'm a guy and I'm single.
Hi, so I'm Faye, I am 31, I've been in a relationship now for over 5 years and I'm just at the start of my endo journey.
Happy to have you all. Shall we just dive straight in and get to these questions? When it comes to periods, what did you grow up thinking was normal? Can we all name normal PMS symptoms? And when I say normal, like nothing's normal. So what do your idea of normal? What do you think?
To be honest, years I've had period pains from my first period when I was about, I think I was about 14. And the pain was that bad that one time I was on the couch screaming and I asked my little brother to ring an ambulance and my auntie got there just in time and my mum went mad. She said, you can't be calling an ambulance for period pains. But then she eventually took me to the doctors because of the pain and I got put on the pill so early.
Yeah.
And I've recently come off, well I say recently, about 3 years ago, came off hormonal contraception.
Yeah.
And my period pains are getting worse and worse, but because it's so common, because it happens every month, it became my normal.
I can only speak from having ex-girlfriends, and from their perspective, I think they're like kind of almost like protective of their body when they're going through their period. So it's like from my perspective, it's always like, oh, I'm at period. And then that's the end of conversation.
Wow, okay.
Or in the sense that I don't think they wanted to disturb me or like make me worry. So
Yeah.
it's like, just let me handle it. I'm on my period. Like, it's a very me thing rather than like an us thing.
Okay.
Yeah, so I think from my perspective, what's normal is just like, it's something she's going through that I can help and assist, but it's not like a thing that I can truly experience. I think that's all in the communication with your partner. It's like, hey, I don't feel so well, I want this. Or like, can you help me with this, right? It's a communication thing, it's not like a physical thing for me.
Okay.
Yeah, so it's like emotional support. What I experience is like lethargy, so like she's tired, don't want to do anything, instead of us going out, let's just sit at home and watch TV.
Love it.
Yeah.
Alisha, period pain, how do you feel about that? Do you
Yeah.
experience it?
I do. I think every woman has probably experienced it at some point in her life, especially like in the first 2 days of having your period. But I think even like before my period, for me, it's always like the uncontrollable need to like cry and eat at the same time.
Yes.
Like eat anything and cry. And I'm like, I think,
Yeah.
maybe she's coming.
Yeah. What is a normal period?
Some light bleeding or some light cramps that don't interrupt your day, that don't stop you from doing things. Absolutely not what you're experiencing, Faye. It shouldn't stop you from going about your normal day. You should be able to take some simple pain relief as directed on the box by a doctor, and carry on for about 5 to 7 days. And the pain and the symptoms that you were describing can happen about a week leading up to your period. So some women experience fatigue, some women experience increased hunger, and some women really experience that change in mood, and that's quite commonly the week before your actual bleeding starts. But I guess what's important to understand is every woman's experience of a period is different, and everyone's experience of pain is different as well. So what's an acceptable amount of pain to one woman might not be to another woman, and so that's why it's really hard to understand what each individual woman is going through with their period. But it's why it's important to listen to them.
Be honest. If a friend said my periods are brutal, what would you assume would be a bit of bad luck, a bit of stress, or that's just being a woman?
With the endo diagnosis and learning that actually it's quite common in women to be diagnosed with endo, I'd say go to your GP and see if you can get some ultrasounds, go to a specialist and start looking into it.
Not as much with my female friends, but definitely my cousins and stuff. So like, I remember my first instance of encountering what a period was we're going to the beach, and then I was like, hey, do you want to come to the beach? And she's like, no, I'm on a period. So from my perspective, it's always been like, oh, that's lame, like that sucks.
Yeah.
But it's never actually like a physical thing that's stopping you from doing anything. I think from my perspective, it has always been like, they just choose not to because they're uncomfortable, rather than it's actually a thing that stops you in your tracks, sort of thing.
It's tricky. It's so hard. I think, you know, obviously your experience, Faye, of like being on the couch, like writhing in pain, definitely not something that I think is what any woman would want to experience and should experience. So definitely, my friend told me that, I'd be like, okay, this is outside of my remit. You definitely need to like see a specialist and a doctor. But if it's just, and maybe even this isn't fair for me to say, but a couple of days of pain, and maybe your mood is really down and you quite irritable. Yeah, I guess that's what I consider normal.
We can be dismissive as well, because I think a lot of times it's like, oh, she must be on a period, and then you go like, oh, but they can't control that, right?
Yes. Yeah.
But then you kind of dumb it down that experience into just like a single comment, rather than like a physical experience that is life altering.
I don't think any woman would choose to experience what Faye has described today, you know, and I think if we could control our moods, we absolutely would, but it's something so out of our control. I agree, just not what you would choose to happen. It's not, you're not just preparing for the bleed. Yeah. It's something that you can't control, and it just, it gets dismissed way too often. So I think if my friends know that they can talk to me about periods, obviously I've had quite a open relationship with my girlfriends for a long, long time. But if someone was telling me anything like what you've described, exactly what you said, encourage them to go talk to someone else, go talk to a GP or get a referral to a specialist. Because I think it's about time we all spoke up and said what's, you know, not normal or what's not acceptable, and even just going and having that story listened to by somebody else and getting you some advice.
Who here uses apps to track their symptoms or menstrual cycles? Has it changed how you understand your body at all?
Yeah, so I actually do track my cycle. I started 3 years ago when I came off hormonal contraception. And yeah, it's been going great, to be honest. And I started reading all the books on it and learning when you feel good, when you are more in your head, the inner critic, has been absolutely amazing. And not just that, it's like being able to inform my boyfriend of when maybe I won't be my best, like Shane was saying before, when I might not want to go out for dinner, instead sit on the couch and just watch a movie. So yeah, I'm loving it. I think it's absolutely incredible. It's been so good.
I don't know my friends' like times or like calendars. But I do know that girls tend to track it, but to what extent, or if they pre-plan things, I don't know. Yeah. Usually, I just know that as a fact. Like even with girlfriends, you'll be, oh yeah, you know, I've got periods this week, or like this past few days. So I'll keep that in mind. But I will not know when it starts, nor will I know when it finishes. It's just more like, oh, by the way, it's done. I was like, cool. But that's the extent of me knowing, rather than me actively checking my calendars and you know, actually put down dates for it. Yeah.
Oh, that's fair.
Yeah, but maybe I should. I feel like if you care about that person, you know, whether they're doing well or not, you know, you should probably like be more specific about the days that they might be more available.
I'm in a long-term relationship with my period tracking app. Yeah, okay. Like 9 years, coming up to 10, I think. Yeah.
Which is like unheard of.
Yeah, really.
It's a lot of data.
Thank you. My period tracking app is so old, but I can't switch because it's so much data. Yeah, I love it. It's given me more confidence to understand my body, like to the point where I know when I drop out of like ovulation into luteal, and I'm like, oh, she's gonna be here in an hour, and it's like it's always right, which is amazing for me because I'm so in tune with my body, which I think is really important. And then kind of like going back to what both of you said, like I'm single, and when I'm dating, I'm like, I notice I say yes to dates ovulating, and then when I get to luteal, I don't want to do it, and I have to tell the guy. I tell them.
Oh, good on you.
I'm like, you should know I'm in like a luteal phase, and we need to do something more cozy than like I don't want to be, I don't know, bungee jumping. They don't think bungee jumping.
Well, what does luteal mean, sorry?
So luteal phase, and you can probably, you know what, why don't you tell us what luteal phase means?
There's 2 phases to your cycle, or a woman's cycle, sorry. Follicular and then luteal phase. So follicular is when you're creating a follicle to release an egg, and luteal is becoming pregnant or getting close to when you're having menses if you don't become pregnant.
Why do so many people normalize symptoms that actually deserve investigating?
I think it's a lot of fear, like we've spoken about. Sometimes you don't want to know that something's wrong, but sometimes it's a lack of understanding or that conversation at home or conversation with the friends, knowing that this isn't normal. So we've all spoken about what's normal for us. Periods haven't always been something that you could talk freely about, and I think that is changing, thank goodness, but it's not something that's going to happen overnight. And so I think women sit at home with their symptoms, and how do you compare what you're experiencing to what someone else is experiencing? And so there's a bit of a lack of understanding of what's normal and what you should go and see somebody about. But that's why it's so important to speak to somebody who literally spends all day talking about periods, because I do have a broader understanding of what's normal, and I can help you figure out what's normal and what might need more investigations. Important parts of my job is to be listening, just sit there and make someone feel safe and able to tell me everything. Nothing gets hidden in my room. I think it's a societal pressure that, you know, this is normal, this is part of being a woman, just get on with it. And it's been that way for a while, so it's hard for us to change that, but that's why it's important for people like us to get out there, talk about it, and encourage other people to seek help or go and talk to a specialist.
When I was a teenager, right, like all your problems felt a lot bigger than what it is. So you kind of, and also you're anxious, right? So you doubt yourself all the time. So what you consider is normal might not actually be normal, but you think it's normal because you're like, I'm just being overdramatic.
Yes, well, hormones make you think all things.
Exactly, yeah.
The emotional side, I guess, is hard sometimes to figure that out, but the pain and the amount of bleeding is something that's quite, you know, we can figure that out, whether it's normal or not normal. If you don't feel safe or if you don't feel heard, you can always seek another opinion, and hopefully your friends or someone will know someone else that they've had a good experience with, maybe, that they could suggest for you. Or I guess social media is getting voices out there that maybe sound a bit more approachable. Or there's always someone. Keep trying. Don't want people to ever be disheartened into trying again to get heard.
Okay, so before you had answers, what did you think was happening in your body?
Yeah, so I just thought I had IBS. For 8 years, I just thought I had IBS and I needed to meditate, and the bloating and the painful periods. Well, the painful periods I just thought was normal, but it did get to a point about 3 months ago where my manager was like, come on, you need to go to the doctors and figure this out. And then I didn't have a clue what endo was. I literally had no clue. And because I got a bit upset in the GP room that day and I saw a male doctor, I don't know if he felt a bit sorry for me, especially because I was so emotional. He says, right, we're going to do absolutely everything. So I was booked in for like ultrasound and everything. And when I went to the doctors again for my results, and I saw a different doctor there, a woman doctor, and she said, have you heard of endo before? And I said, I've heard of it, but I don't know anything about it. And she said, well, it looks like you have got endo. And then she asked me, when do you think you'd like to plan for a child? And I said, to be honest, not for maybe 5 years. And she said, I wouldn't wait that long. She said, somebody with endo can struggle. And I honestly just broke down. And it's just, it made me upset. I was obviously very upset because obviously that's so scary hearing that, because obviously I feel like I'm born to be a mother in the future. But being diagnosed with IBS, I honestly thought it was IBS my whole life, and endo just never came into the picture as well.
Yeah, I think it's so interesting because like even hearing you talk about like painful periods, like I have really painful periods for the first couple of days, but then I sit back and I'm like, is it just painful to me? Is it actually painful? Like it kind of resolves itself after a couple of painkillers, but then I do that for a couple of days. So you just like all these questions now circling in my head of like, should I be going to a doctor to, you know, see if I can get diagnosed for something or just even further investigation. But
so I think it's textbook answer is any kind of pain that requires simple over-the-counter analgesia, which is paracetamol and ibuprofen. If it's managed with that, then I think that's textbook normal. The really important message that I'm trying to get out at the moment and talk amongst my girlfriends is there are things that you can do preventatively. We're all about how we can do preventative health measures, I think, in our lives at the moment. There's a big push, a big culture about longevity. And I think we can do simple things now if we're at all worried, if we're thinking that any of these symptoms or signs could be something that could interfere with your fertility in the future. There's no harm in going to see a specialist and get some simple investigations and have a chat about fertility, have a chat about what you think your family might look like. And then they might even talk to you about a blood test called AMH, which is really simple. It's your ovarian reserve, and that can give you an idea about how to plan for how many children you might want in the future. Women with endometriosis or adenomyosis or polycystic ovarian syndrome, women with these conditions, I talk about AMH earlier and have these conversations earlier so that they can hopefully make some changes or make some plans or even use preventative measures like egg freezing or oocyte freezing to help them have a family that they want in the future and prevent these conditions from impacting on their fertility.
What is endometriosis? What is PCOS? What is adenomyosis? And what are fibroids? And I have all of those. So I'm so excited to hear this. Let's go.
Okay, so endometriosis is really common. We know that it's in about 1 in 7 Australian women. It's a condition, a reproductive health condition, that the lining of the womb or cells like it are outside of the womb. So they're where they shouldn't be.
Yeah.
But they respond to the same hormones that run your cycles. So how I describe it in my rooms, I have a little diagram and I have a little model which helps. But these cells get inflamed and angry like your cells would before a period, but they can't bleed out because they're in the wrong place. So they get inflamed and angry, and can cause scarring and can cause the symptoms that we know about. So painful periods, pain with sex, pain with a bowel motion, pain with bladder, emptying your bladder. So that's endometriosis. Adenomyosis is where those cells are in the muscle layer of the womb. So you can get a bigger, bulkier uterus, and both of those conditions can impact on fertility. Polycystic ovarian syndrome is a really complex syndrome that interferes with a lot of your hormone imbalances. It's an endocrine condition. It's not just a condition that affects your reproductive health. It affects a lot of things, and it can lead to diabetes and other health conditions that we need to be aware of. But in terms of put my gynae hat on, if we're just focusing on that, it can lead to irregular cycles or lots of follicles on your ovary, so a bigger ovary with lots of different follicles inside the ovary. You see that on the ultrasound. And it can lead to anovulatory cycles, which is important when we're talking about fertility, which means it cycles when you have a period. Afterwards, when you're growing that follicle, you might not actually release an egg, which is really important when you're trying to have a baby. So there's 4 types of fibroids. There's one that lives inside the lining of the womb, the cavity of the womb. That's called a submucosal fibroid, and they can have a big impact on fertility because that's where an embryo would like to implant. Then there's an intramural fibroid, which grows in the muscle layer of the womb. Then there's a serosal fibroid, and they grow on the outer layer of the uterus. And then there's ones called pedunculated, which sit on a little stalk inside your pelvis from the outside of the uterus. So they're a benign growth of the uterine wall, basically.
And they're all benign then?
Very rarely they can turn into cancer, but majority of the time in young reproductive age women, they are benign.
And they can cause pain as well, right?
Absolutely. So anything that increases the size of the womb or the surface area of the endometrial lining, that's why we talked about those submucosal fibroids, anything that increases the surface area can increase the bleeding. Anything that increases the size of the womb can increase your bleeding. So we talk about heavy periods, painful periods, or interfering with fertility, implantation, or the size of the womb.
I mean, the way I see it, it's more than, obviously talking about fertility, but it's more than that, right? It's pain, it's lifestyle, it's cancer causing potentially, so it's life, sometimes life or death, right? And we're lucky to even talk about the outer aspect of it, which is literally fertility. You just want to give kids out.
If someone watching is experiencing any of these conditions, when should fertility become part of the conversation?
Like I mentioned before, I do like to talk about preventative health, especially with women. We have options now with egg freezing. But basically, it depends on the woman. A woman may present to me and literally want to fix their pain, their bleeding, and not worry about fertility, and that's every woman's journey. But obviously, I'm a fertility specialist. A lot of these women do want to seek help having a family. So you have to just ask them what their main concern is and what their priority is. Especially with endometriosis, I often find my conversations are, do we want to focus on your pain and bleeding? Do we need excisional surgery? Do we need hormones? Or are you trying to have a baby? And sometimes we do one and then the other, and sometimes we have to focus on one because you can't have hormonal management if you're trying to have a baby. So it's basically asking the woman what their priority is, what their main concern is, and addressing that. But if anyone's got symptoms that they're worried about, go seek help, go have a chat, go meet a specialist. Like I said, I see a lot of women earlier on, and then they know who they can come to when and if there's a problem in the future. Or it may be just to get some reassurance to try and conceive naturally. But if that's not working, know where to go soon, so you're not waiting. You're not waiting a year, you're not being told another year, you're not being told another year. There's time for me to then intervene and do things sooner. Another thing to note is there's some guidelines, and GPs, general practitioners, will know this as well. So if you present and you've been trying to have a baby and you're under the age of 35, there's a guideline timeline of about 12 months of trying, and if you're going past 12 months, please seek help. However, if you have one of these reproductive conditions, I advise you to seek help sooner than that. And I will never turn someone away from being seen and having education, and I think that can sometimes be valuable ahead of time. And there's little things that we can tweak and little things we can look at even at that appointment, and then you know where to come back if you're still not falling pregnant by that 12-month period. It doesn't mean we're always going to do something, it just means sometimes you know where you're coming back to if you haven't fallen pregnant by this time. If you're over the age of 35, that time frame is shortened to 6 months. Again, if you have one of these conditions though, the GPs will often know to refer earlier than that even.
And is it the same for men as well?
Yes, that's the same for men and women. Under the age of 35, 12 months as a guideline, and over the age of 35, 6 months. Caveat to that is, if there are any of these reproductive conditions, you can seek help earlier, or if you're concerned, I genuinely feel women know their bodies better than anybody else. If you're concerned, absolutely go earlier.
Did you know before today that these conditions could impact fertility?
Yes, I did, especially when I was sat in that GP room. As soon as I got diagnosed, I was told then that I could have issues.
I think so too. Yeah, like I think there's so many. It sounds like there's so many aspects that affects fertility, not just like medical conditions. It's like mental, you know, all the extra stuff as well.
Do you reckon this is, you know, now that you know a little bit more about it, you'd be able to offer some more support? Do you feel confident in that?
But and also, like, I guess point them, well, not point into the right direction, but can raise it early, even just with friends as well, right?
Yeah.
People around me, not just like my partner.
Yes, love that.
Excellent.
Yes, that's so good. We need more of this.
I definitely knew about endometriosis and PCOS, but the last two, like fibroids especially, just I didn't 4 types. I didn't know.
Yeah,
She had my model.
I know.
I'm almost like,
Where are they?
Yes, I'm such a visual girly. I love those little things that you guys get out. I'm like, oh, that makes more sense. But I didn't know there was 4 either. I just had one removed in a few months ago, and I forgot to ask my doctor which one.
Where it was.
For those watching, what are the 3 symptoms that should prompt a check-in, especially if somebody is thinking about future fertility?
Painful periods outside of what's expected, so requiring more than just simple analgesia and interfering with your day-to-day life, stopping you from going to work, stopping you from participating in your normal hobbies or activities. Heavy bleeding, so that's really hard for a woman to compare to another woman, but I think the menstrual cups are helping us compare, just on a side note. And then pain with intercourse, so something really not spoken about, but pain with intercourse is not normal, and pain with opening your bowels, or when your bladder's full in the morning, or painful urination. I think also we mentioned it before, if you're trying to conceive for longer than 6 months if you're over the age of 35, or 12 months if you're under the age of 35, or if you're suffering from any of these reproductive conditions and trying to conceive and not having any luck, or a bit confused or a bit lost, seek help as well.
Yeah, definitely. So after our chat today, everybody, what is something that you've learnt?
I didn't even know what a fibroid was. Never mind, there was 4.
I know, there you go. I didn't know there was 4. So same.
After hearing everyone's stories, I find how privileged I am to just be able to feel normal when everyone else is going through these sort of pain, even just to all this effort just to feel normal. But the thing is, normal is so subjective and it's different for everyone. So yeah, it makes me feel like I'm quite privileged just to say that I know how to experience it despite all the things everyone's going through.
I think it's made me realise that maybe I need to book back in with my GP to just have a chat about some things and see what's going on, because there's been so much knowledge that's been shared.
Yeah.
And really just me questioning what is normal to me and just having that internal conversation with myself.
Well, we all know there's such a delay in diagnosis for endometriosis.
Yeah.
What we're trying to do here at the F-Chat is really reduce that delay. We're trying to raise awareness, increase discussions, and get you seen earlier, and really try and improve your quality of life, or reduce potential fertility problems in the future.
So good. Look at us go. Thank you guys so much. Honestly, having these chats, my biggest hope is that it just takes, one person even to see, and then to be able to book in and have a chat and go from there, so they don't have to suffer in silence for as long as we did. Thank you so much, guys. Appreciate you.
Thank
you.
you.
Thanks.
Yeah.